Today we're going to be reviewing a paper which discusses a clinical trial of a medication called pioglitazone on the behavioral aspects of autistic children. Pioglitazone is a drug that's in clinical use today. It's been used to treat over 1 million type 2 diabetics. Primarily, the drug is used to increase insulin sensitivity in peripheral tissue. The drug increases insulin sensitivity by being an activator of the PPAR gamma. PPAR gamma is a transcription factor which, when activated, increases in adipose tissue and in muscle cells, increases their ability to respond to insulin. Now, why would this drug be contemplated for use in autism? The authors of the paper describe the other observations in the rationale. Observations that children with autism have altered immunological functions and immune dysregulation. So, for example, the paper reviews work by Warren et al., which demonstrated increased T cell and B cell proliferative responses to mitogens in children with autism as opposed to controlled children. So essentially this would mean that these children have an abnormal immune response. This was an older paper. Another paper which the authors cite is a publication by Stubbs et al. Demonstrating that 5 out of 13 autistic children had abnormal antibodies to rubella even after immunization with vaccine to rubella. So they're trying to develop this hypothesis that there's an immunological abnormality in children with autism. And then the paper cites a more recent study in which autopsies were performed on children who had autism, post-mortem autopsies, and demonstrated neuroinflammatory lesions and activation of microglia and astroglia in sections of nervous system tissue of autistic children. So the authors are taking this idea of immune deregulation and wondering if they can treat it with the drug pioglitazone. They can inhibit the immune inflammation. The family of drugs to which pioglitazone belongs to is in clinical trials. Different other members of this family are in clinical trials for their anti-inflammatory activity, and pioglitazone itself has been demonstrated to inhibit glial activation in animal models, various animal models of neurological deficiencies, but also this drug was demonstrated to shift Th1 inflammatory responses to Th2 responses. So based on that rationale, the authors of the paper recruited 25 patients, 22 males, 3 females. Average age was 7.9 years, with the range of children between 3 to 17 years old. These children were diagnosed with autism spectrum disorder using the DSM-4 checklist criteria. These patients were non-responsive to behavioral or nutritional therapies or to other therapies such as intravenous immunoglobulins, secretin, chelation, and other types of therapies. These children were non-responsive for at least a year. Now, the children were treated with 30 milligrams per day oral or 60 milligrams per day of the pioglitazone, depending on the age of the children. Treatment was for 3 to 4 months on a daily basis. The children were monitored for blood counts, glucose, insulin levels, and various metabolic assays were performed. It is important to note that the clinically used dosage for type 2 diabetes is usually between 15 milligrams to 30 milligrams a day orally. So these doses of 30 to 60 milligrams were a little bit high. The patients who were receiving the pioglitazone, there was no abnormalities detected in the 4-month observation period, no elevations in hemoglobin, creatinine, blood urea nitrogen, or insulin levels. There was 2 incidences of slight and transient elevation in white blood cell counts and glucose levels, and there was 3 incidences of transiently elevated liver enzymes. these elevations, they resolved without intervention and without stopping the drug. In order to analyze any efficacy of pioglitazone on autism, the scale that was used is an accepted scale. It's called the Aberrant Behavior Checklist. Essentially, this is a checklist of 58 questions which are asked to the caregiver of the child. These questions are broken down into subsets, five subscales, which cover hyperactivity, inappropriate speech, irritability, lethargy, and stereotypia. These questions are rated on a 4-point scale, with 0 meaning there is no problem. Questionnaire was performed before as a baseline before pioglitazone therapy was initiated, and as a follow-up 12 or 16 weeks later. The results of the study show that after 3 to 4 months of treatment, there was a statistically significant decrease in the subscale for irritability, lethargy, stereotypy, and hyperactivity. However, inappropriate speech was not decreased. And very interestingly, the younger children appeared to have responded higher, statistically significant higher, as opposed to the older children who were receiving the pioglitazone therapy. So in conclusion, this study was an open-labeled study. Being open-labeled, of course, there's a possibility of placebo effect, which is rather high in these kind of studies. Other studies reported placebo effects between 25 to 37% in using similar scales as the one used. Nevertheless, in this study with 25 patients, 76% of the patients responded using a relatively high criteria of response, being more than 50% improvement in at least one subscale. So if you look at this study and compare it back to other studies which there was placebo effect, this study still seemed to have demonstrated a higher level of higher level of response as compared to placebo effect. So next steps for this kind of investigation, we believe these investigations should have looked at standardized immunological criteria before and after intervention, and trying to correlate the immunological criteria with the behavioral effect. The other question too is, can these studies be made to have better inclusion-exclusion criteria? It seems like there's a variety of different factors that come into autism, and maybe by making studies with tighter inclusion-exclusion criteria, we can see better effects. And of course, are there better scales and better ways to avoid placebo effect? Thank you very much.